Good afternoon. Thank you for joining us. We want to give you an update on our COVID situation. I will start with some reasonably good news. When we started our vaccine distribution efforts in our county, we had set an initial goal we felt was aggressive at the time. We said in January we wanted to administer 250,000 vaccines. I can share with you that to date we have administered more than 269,000 vaccines. Obviously, we are going to continue to push and expand as rapidly as possible. In large part, our abilities to have sustained and significant increases is limited by the availability of vaccines, but we are hopeful that that situation will turn around and we will get a more consistent, steady stream of vaccines. But we will continue pushing aggressively ahead to build out more locations with more options and higher volume and make it easier for folks to get into that system. The other good news is demand for appointments still remains exceedingly high. The biggest complaint we get is people say, I can't get an appointment, and the minute that they are made available, they are gone. And while we know that is frustrating to folks who want to get it, it is encouraging overall at the demand of where we are. Well, the stay-at-home orders have been lifted with San Diego County now back in the purple tier, and with vaccine administration moving forward robustly, we know that we still have a fair amount of work to do as it relates to cases. We want to see continued effort of bringing down our positivity rate. We want to see the downward trend we've been experiencing in cases continue. And we have to do this all with the presence and awareness that a new, more contagious strain is in San Diego County, and that requires us to remain vigilant, to not be complacent, to continue to take all the necessary precautions to slow the spread, and to have some hope because of the vaccine and the increased numbers of vaccine, but to have that hope motivate us to be more diligent and more focused to lower the cases, because we know it is not something we will have to do forever, but we are going to be in the posture of assessing case counts and hospitalizations and having those numbers drive what can be open for a while. And so we want those cases to come down. We want to go from the purple tier to the red tier into the orange tier and rapidly work our way out of the situation as a county. As I mentioned, we will show in a moment on our dashboard that we have administered 269,218 doses of the vaccine. I want to thank our county staff at sites. I want to thank in particular our healthcare partners who are both working with us at many of these sites and are also doing vaccinations in their own locations for their work. And I know everyone is working around the clock and tirelessly to ramp up the availability and supply of what we're doing, and we will continue to move fast to have an effective, efficient, and equitable distribution of the vaccine. We are also continuing to increase the availability of locations where individuals can get it. We now have 7 community pods. These are places that do, say, 500 vaccinations a day, and these are in the cities of Chula Vista, National City, Imperial Beach, San Diego, Escondido, Oceanside, and El Cajon. And these can all be accessed for an appointment via MyTurn. Supervisor Vargas in a minute will walk you through the interactive map that shows the locations of these, along with the process you access these via MyTurn. Our plan and goal is to bring on 6 more of these community pods or points of distribution in February so that there are more points and accesses for those to go. We also have our 2 vaccination superstations, the one at Petco and the one at Sears, the Sears site in Chula Vista. And this Sunday, our North County sponsored vaccination superstation will open at Cal State San Marcos' athletic complex. We will begin taking appointments on Saturday, and we will begin administering vaccines on Sunday. We are sponsoring this site in partnership with the university, along with some staffing support from Tri-City Healthcare, UC San Diego, and Palomar Health. That site will be open Sunday through Thursday, 9 a.m. to 3:30 every week. And again, appointments are required, but again, that is opening a 3rd vaccination superstation, and we have plans very quickly to get a 4th one up in East County sometime next week. And so we're continuing to add pods, continuing to add superstations, and continuing to ramp up the availability we can. But again, this is all contingent upon the supply of vaccine. And so we are building a system to administer vaccines that we may or may not have. And so we're going to continue our approach to build it out as robustly and rapidly as we can in hopes that the vaccines will arrive. We have told you, San Diego County have mentioned we had a dashboard or interactive scheduling thing we had developed. We decided to wait and go with the state. We didn't want to have people switch systems midway. And so we are in the pilot project with the state of California. This is the My Turn system, and it is presently being used for all 7 of our community pods. We've added a regional map and search function that will make it easier for individuals to find a vaccination site near them. This is very similar. If you interacted with the testing one, you will find it is very similar to that. And we've been working to clean up some of the functionality of My Turn to make it easier with the first and second appointments. And we think that it is functioning better today than it has been. All of the county-sponsored pods are utilizing My Turn. When we bring on the Vaccination Supercenter in North County, it also will work via My Turn. And when we bring one on in East County, it will work via My Turn. And we're in the process of migrating both Petco registration and Chula Vista registration into My Turn. And the aim is so that every one of our sites is scheduled through the exact same process. And we encourage you to go to vaccinationssuperstationsd.com where you can make your appointment. And again, Supervisor Vargas will walk you through the map, the interactive nature, and how you would schedule that up. And for those 75 and older who do not have access to a computer, you can call 211 and they will actively help schedule you for an appointment if there is one available. Again, we're getting significant numbers of calls, and the ability to schedule folks is dependent upon the ability of appointments to be present. And again, we are pleased asking, this is for 75 and older only who do not have a computer. This is not a vaccine helpline or vaccine complaint line. This is for vulnerable seniors who do not have access to the internet to be able to schedule their appointments. I want to tout two other quick things, and then we will jump into our charts. As chair of MTS, I'm very proud of Metropolitan Transit System, what that agency has done in COVID, continuing to provide help and assistance and the availability of transit to our essential workers and folks that are transit dependent. MTS is stepping up again to help get people to vaccination sites. Starting today, MTS will provide free rides on our bus and trolley network to anyone who has a vaccine appointment for that day. And so if you print off your appointment form and you take it when you get on the bus or you get on the trolley, you can ride fare free to your appointment and then back home on the day of your appointment. Many of our vaccination sites are sited strategically along transit lines to make it easier for individuals to access them and get to them. And we certainly appreciate MTS stepping up to try and make it a little bit easier for folks who may want to utilize transit in order to get to their appointment. And the other update is HEAL. HEAL is a national, H-E-A-L. HEAL is a national mobile healthcare company with operations in San Diego County. They have come on board and will be helping and assist our fire agencies and Champions for Health in increasing the number of long-term care facilities we can get to on a regular basis to administer vaccines to those. And so we are very grateful for them. With that, let's jump into today's charts. There you can see an update of our vaccine dashboard. 485,900 is total doses shipped to the region. Again, this includes doses shipped to multiple entities across our region. And I know all of those entities are working hard at getting the vaccinations administered quicker and updating the immunization registry to reflect. But there on the second line, you can see on the right-hand side the total doses administered, 269,218, surpassing our initial goal of 250,000 in January. And there you see the breakdown in first dose and second dose and the percentage of population fully vaccinated. And again, as the supply becomes more steady, we get more locations stood up, we think these numbers will move much quicker as we head into February, but solid progress so far. In terms of cases, today we're reporting 1,489 new cases. Again, this is down considerably from where we were not too long ago, with more than 4,000 cases being a not uncommon occurrence there for a period of time. We need this number to continue to come down. We want to see continued downward trajectory in this number. Again, 1 or 2 days does not make a trend, but we've been kind of plateaued there at about 1,400, and we are hopeful that folks will continue to adhere to the public health orders and see this number begin to come down. Again, on the next slide, you'll see here our hospitalization. This is COVID-related hospitalization. You can see a slight downward trajectory less downward with ICU utilization, a little more downward overall. Again, somewhat encouraging, but we would like to see this on a little bit steeper curve. And then on the next chart, you can just see our ICU bed capacity. And again, the COVID numbers there on the bottom are holding relatively steady. Non-COVID numbers are going to tick up a little bit, and then you see the staffed and immediately available. It is entirely possible that even if the COVID numbers begin to decline, the overall availability will not change. We have to keep in mind a lot of individuals had their needed and necessary healthcare procedures canceled or delayed. And so our healthcare systems are going to have to do a lot of work to catch up. And so we expect a fair amount of strain on our healthcare system as we move forward, as they catch those up and continue to deal with COVID. And then our next chart here is just our loss of lives. Today we're reporting 69 San Diegans who died as a result of COVID-19, bringing our total to more than 2,500. Final chart for the day. This is one you all will be familiar with from the late summer and fall when we were in the tiered system. What you see on the left right there is just the running tally of our unadjusted case rate, and you see where that spiked, 65 jumped to 89, 97, down to 67. The second chart over is our adjusted case rate, and this is where we get the adjustment based on how many tests we're doing. We're doing considerably more testing than the average, so we get a little bit of an adjustment factor for that, and you can see that dropping from 69 to 60 to now 49.6, along with our testing positivity percentage, which you can see moving as well. On the right-hand side of this chart, what you see is where we need to be to go into other tiers. And a lot of you will remember the anxiety for a considerable amount of time about 7.0 for red, and are we 6.9 or 7.1? But what you can see right there is we have to get our case rate per 100,000 down to 7.0 in order to descend into that next tier. That case rate right now is at 49.6, and so that tells us we have a ways to go, which is why we continue to implore the public to please be careful. Let's follow the public health orders, and let's continue our current trajectory. With that, please welcome Supervisor Nora Vargas.